tingling, burning, numbness, that pins and needles feeling, or worse, like you're walking on broken glass. If this sounds familiar, you're not alone. Peripheral neuropathy affects millions of Americans, especially adults over 60. In fact, studies estimate that up to 25% of people over age 70 experience some form of nerve damage in their feet and legs. But here's the part most people get wrong. They think the only solution is medication, painkillers, nerve drugs, supplements. And while those can help manage symptoms, they often don't address the root cause. What if your body already has the ability to repair those nerves? Because research suggests it does. Today, I'm going to show you 6 simple doctor-recommended exercises you can do at home in just 15 minutes a day that may actually help stimulate nerve regeneration, improve circulation, and reduce symptoms of neuropathy. No gym, no equipment, just a chair. Number 1, what's really causing your symptoms? To understand how to fix neuropathy, you first need to understand what's going wrong. Your peripheral nerves act like electrical cables. They run from your spinal cord, down into your legs, and all the way to your toes. They carry signals like pain, temperature, pressure balance, and position called proprioception. When these nerves are damaged, those signals become distorted. Instead of clear communication, your brain receives noise. That's why you feel burning, tingling, numbness, sharp or stabbing sensations. Common causes of neuropathy. The number 1 cause is diabetes. High blood sugar damages nerves through multiple mechanisms, including oxidative stress inflammation, a process called glycation, where sugar molecules bind to proteins and impair nerve function. In fact, diabetes accounts for nearly 40 to 50% of all neuropathy cases in the US, but it's not the only cause. Other common contributors include vitamin B12 deficiency, especially in people taking metformin or acid-reducing medications, chronic alcohol use, which is directly toxic to nerves and depletes B vitamins, chemotherapy, autoimmune diseases, obesity, and metabolic syndrome. And in about 30% of cases, no clear cause is found. This is called idiopathic neuropathy. Number 2, what actually helps? Here's the encouraging part. A growing body of research shows that exercise is one of the most effective non-drug interventions for neuropathy. One landmark clinical study observed patients with neuropathy before and after a structured exercise program. Researchers performed skin biopsies to measure nerve fiber density, and what they found was remarkable. After consistent exercise, new nerve fibers had actually grown back. Not just symptom improvement, not just pain reduction, but measurable physical regeneration of nerve endings. That's a big deal because for years the belief was that nerve damage was largely irreversible. We now know that under the right conditions, the nervous system has the ability to repair itself. Number 3, why exercise works. These benefits come from several mechanisms. 1, improved blood flow. Nerves need oxygen and nutrients to heal. Exercise enhances circulation to the lower limbs. 2, neuroplasticity. Your brain and nerves can adapt and rewire. Movement reinforces these pathways. 3, reduced inflammation. Regular physical activity lowers chronic inflammation, which contributes to nerve damage. 4, better glucose control. In people with diabetes, exercise helps regulate blood sugar, slowing further nerve injury. Number 4, the 6 best exercises for neuropathy. These are divided into 3 key categories: cardio to stimulate nerve repair, balance to prevent falls, foot activation to restore nerve muscle connection. Exercise. 1, seated march, cardio foundation. Sit upright in a sturdy chair, lift one knee at a time like you're marching in place. Add arm movement, opposite arm with opposite leg. Keep a steady pace where your breathing increases slightly, but you can still hold a conversation. Start with 3 to 5 minutes. Gradually work up to 10-15 minutes, twice daily. This is your foundation. Exercise 2, single leg stand, balance training. Stand behind a chair for support. Lift one foot slightly off the ground. Hold for 10 to 30 seconds. Repeat 3 times per side. As you improve, use one hand instead of two, then no hands. Eventually try with eyes closed, advanced. This retrains your proprioception, which is often impaired in neuropathy. Exercise 3, heel to toe rocks. Stand with feet shoulder width apart. Slowly rock back onto your heels, toes lift, then forward onto your toes, heels lift. Perform 15 reps, 2 sets. This improves balance, calf strength, sensory feedback from your feet. Exercise 4, calf raises. Hold onto a chair, rise slowly onto your toes. Pause, then lower slowly. Do 12 reps, 2 sets. Why this matters. Your calf muscles act as a second heart, pumping blood back up your legs. Better circulation, better nerve health. Exercise 5, towel scrunches. Sit in a chair, place a towel under your foot. Use your toes to scrunch it toward you. Do 10 repetitions per foot, 2 sets. This strengthens small foot muscles and improves nerve signaling. Exercise 6, ankle circles. Lift one foot slightly off the ground. Draw circles with your foot, 10 each direction. Then write the alphabet in the air using your big toe. This improves joint mobility, nerve activation, coordination. Number 5, your 15-minute daily routine. Here's how to combine everything. Part 1, cardio, 5-10 min. Seated marching. Part 2, balance, 3-5 min. Single leg stand, heel to toe rocks. Part 3, foot activation, 5 min. Calf raises, towel scrunches, ankle circles. Optional, add 20-30 minutes of walking if safe. Number 6, 3 critical safety rules. 1, start slow. Do half the reps initially. Nerves respond better to gradual progression. 2, be consistent. Daily practice matters more than intensity. Nerve regeneration is slow but steady. 3, check your feet daily, especially important if you have numbness. Look for cuts, blisters. Redness, because reduced sensation means injuries can go unnoticed. Number 7, evidence-based supplements and nutrition. While exercise is key, some supportive strategies include alpha-lipoic acid. Dose, 600 millimoles day. Evidence suggests improvement in neuropathy symptoms. Vitamin B12, essential for nerve health. Especially important if you take metformin. Avoid excess vitamin B6. High doses, 50 milliliters day long term, may worsen neuropathy. Nutrition tips. Increase omega-3 fatty acids. Fish, flaxseed. Eat leafy greens. Reduce sugar and processed fats. Final message: neuropathy is not something you have to passively accept. Yes, it's a serious condition, but it's also one where small, consistent daily actions can lead to meaningful improvements. Science shows us that nerves can adapt, they can be repaired, they can grow, and sometimes all it takes is a chair, 15 minutes a day, and the decision to start. If you found this helpful, hit the like button. It helps others find this information. Subscribe for more evidence-based health content. And in the comments, tell me, which exercise are you going to try first?